CDC issues next phase of the Conditional Sailing Order for cruise ship operators. Increasing from weekly to daily the reporting frequency of COVID-19 cases and illnesses, implementing routine testing of all crew based on each ship's color status, decreasing the time needed for a red ship to become green from 28 to 14 days. Today, the Centers for Disease Control and Prevention (CDC) issued the next phase of technical guidance under the Framework for Conditional Sailing Order (CSO), requiring cruise lines to establish agreements at ports where they intend to operate, implement routine testing of crew, and develop plans incorporating vaccination strategies to reduce the risk of introduction and spread of COVID-19 by crew and passengers. This phase, the second of the CSO issued in October 2020, provides technical instructions on increasing from weekly to daily the reporting frequency of COVID-19 cases and illnesses, implementing routine testing of all crew based on each ship's color status, updating the color coding system used to classify ship's status with respect to COVID-19, decreasing the time needed for a red ship to become green from 28 to 14 days based on the availability of onboard testing, routine screening testing protocols, and daily reporting. Creating planning materials for agreements that port authorities and local health authorities must approve to ensure cruise lines have the necessary infrastructure in place to manage an outbreak of COVID-19 on their ships, to include healthcare capacity and housing to isolate infected people and quarantine those who are exposed. Establishing a plan and timeline for vaccination of crew and port personnel. The next phase of the CSO will include simulated trial voyages that will allow crew and port personnel to practice new COVID-19 operational procedures with volunteers before sailing with passengers. CDC is committed to working with the cruise industry and seaport partners to resume cruising when it is safe to do so, following the phased approach outlined in the CSO. COVID-19 vaccination efforts will be critical in the safe resumption of passenger operations. As more people are fully vaccinated, the phased approach allows CDC to incorporate these advancements into planning for resumption of cruise ship travel when it is safe to do so. CDC recommends that all eligible port personnel and travelers, passengers and crew, get a COVID-19 vaccine when one is available to them. Cruising safely and responsibly during a global pandemic is difficult. While cruising will always pose some risk of COVID-19 transmission, following the phases of the CSO will ensure cruise ship passenger operations are conducted in a way that protects crew members, passengers, and port personnel, particularly with emerging COVID-19 variants of concern. CDC will continue to update its guidance and recommendations to specify basic safety standards and public health interventions based on the best scientific evidence available.